Good evening, everyone. Welcome. My name is Attila. I'm the Spanish interpreter. If you guys need assistance with interpretation, there's a little globe on the bottom of the screen in which you can choose the Spanish language for translation. Buenas noches, mi nombre es Attila. Bienvenidos. Si ustedes necesitan ayuda en español, para traducirle, ustedes pueden apretar en el pequeño globo que está al final de la esquina, al final de la pantalla, para que le cambie le traduzca en español y yo voy a ser su intérprete en español. Gracias. Thank you.
Good evening, everyone, and thank you for being here tonight. My name is Dana Giesland, and I'm an assistant superintendent in the Edmonds School District. Additionally, there is a closed captioning on the bottom of your screen. If you would like to tap on that, it will take whatever we're saying tonight and put it into captioning for not only hearing impaired, but just in case you've missed something that we've said. So that's another resource for you. Again, thank you for being here tonight for the Mental Health Community Forum. We have a talented group of individuals who have worked really hard to put together some resources and give you some information. And then at the end of the night, you will have the opportunity to ask some questions and get some thoughtful responses. Our panelists will give you some resources to increase confidence in addressing mental health and strategies to know how and when to start some conversations with loved ones. So really excited that you all are here tonight. I'm excited about this incredible group of educators who are committed to providing this to you. Next slide, please. I'd like to start off tonight with a land acknowledgement. We come to you tonight from and acknowledge the land that we reside in. We acknowledge the original inhabitants of this place, the Sadobish people and their successors, the Tulalip tribes, who since time immemorial have taken care of, hunted, fished, and gathered on these lands. We respect their sovereignty, their right to self-determination, and we honor their sacred and spiritual connection with the land and water. By acknowledging these homelands, we commit to working with tribal nations to further the education aims they've identified in our classrooms and schools. Next slide, please.
So good evening. My name is Joanna Rockwood, and I'm a school psychologist and the suicide prevention and prepare team coordinator for the district. 3 months ago, a district suicide prevention committee was formed with volunteers from school counselors, school psychologists, student support advocates, school nurses, administrators, and district level representatives, with the common focus of saving student lives through evidence-based and culturally responsive practices, reducing stigma around mental health, and instilling hope. I want to thank these individuals for their compassionate dedication, commitment, and hard work towards doing this very important work for us all. The Suicide Prevention Committee members include Cassie Barony, Kelly Christensen, Sherman Davidson, Katrina Guile, Dr. Sally Guzman, Steve Hearn, Kim Hunter, Alex Lewis, Lindsay Mathers, Lily Maluski, Jamie Regis, Cricket Sutton, Kirsten Varg, Letitia Williams, and Amy Whiskerchin. One of the first topics of the Suicide Prevention Committee discussed was the impact of this past year and how we can come together to support our community during this challenging time. Hence the idea to host a mental health community forum. We would like to acknowledge that this past year has impacted many students' mental health. We look forward to discussing how we can work together as a community to support students' mental health today and moving forward. We will be providing tools and resources to help increase your confidence in addressing mental health, how to know when to get help, suicide prevention, and strategies for having challenging conversations with your loved ones. First, some logistics. This is a webinar format. And as mentioned previously before, Spanish interpreter services are available. This webinar will be recorded and available on the district website. All cameras and microphones are off except for the speakers presenting. Please use the question and answer box for any type of logistical questions you might have or questions that come up during the webinar, and we will address those directly. The chat will be disabled. And then in the end, there will be a form to collect your feedback, to get ideas for upcoming events, and in case you need any additional follow-up assistance. So our goals for today is to increase our partnership with parents and guardians in supporting student mental health, to provide information and tools to increase your confidence in helping your student, and to create a starting point for ongoing conversation. The most important place to start when it comes to addressing mental health is grounding ourselves in the experiences of our students and hearing their voices regarding their needs. As the video loads, I would like to thank Kirsten Varg and Katrina Geil for creating this incredible video and for the many brilliant students who agreed to participate in it.
The hardest part of the COVID pandemic has been I haven't been able to see my friends and family, and I haven't been spending quality time.
Well, not seeing friends really, because you don't actually see that many friends.
In the beginning, when I couldn't see anyone at all, and even now when I can't see that many people, and also before we got to go in person 2 days a week, it was really hard being online and kind of worrisome and scary.
Online school is harder than I thought it would be, especially doing it for like a year, and then it's just hard with Zoom and online work, and yeah.
For me, it's just been school and dealing with Zoom and just how the teachers are just like assigning back-to-back work.
It was hard for me to figure out how much I should work every day and how much I should spend. I should give myself some breaks.
The hardest part about the COVID pandemic for me has been the lack of boundary between being at home and being able to do work. So throughout this pandemic, I felt very like I'm never resting, like I'm always doing work, or that I'm constantly tired.
I was actually doing okay, getting working on time, but after a while I just felt drained and felt very unmotivated, had no energy, and yeah, I just really couldn't set up my days right, just because I have a lot of siblings, a big family, and they all got affected by the pandemic in a different way.
What I've learned from this pandemic is how to use the computer.
And to be independent, because when you're in a breakout room, you can't really go up to your teacher and ask them a question about your homework.
I've really gained a new appreciation for in-person school. Like, it's so hard to have to do the stuff remotely, and it's so much easier, so much more easy. That's awesome. I don't care. It's so much easier to do school when you're actually in the building and have people that you can talk to.
Just being by myself and just getting the time to really think, I guess. It just really set my mind to what I really need to do and what I really need to focus on.
The thing I learned from this experience was that I am more capable of doing work and the things I love than I thought I'd be able to do.
I've gotten a lot more appreciative of my family, just because those were the only people I was talking to during the pandemic really a lot, and they helped me through a lot of things. and I've noticed that they're going to always be there for me. So that's something I gained. Another thing I gained, I feel like, is a lot of independence and just wanting to do more things by myself and asking for help at the same time. Before, I feel like I wouldn't ask for help, and if I didn't know how to do something, I just wouldn't do it. Now I will actually go out and ask for help.
One thing I've learned from this experience is like the way that I'm going through this pandemic isn't how everyone else is going through it. So people go through it in different ways, and there's multiple people going through it in multiple different ways. So I have to just be considerate of how they're dealing with it instead of trying to force how I'm dealing with it on them.
I think that I'd feel supported if the vaccines started developing quicker and everyone started getting one, because right now it's usually just the adults getting them, and I kind of want people to start wearing their masks over their noses instead of under.
Advice about troubleshooting, advice about dealing with not seeing friends and having to see them over Zoom, and having them not go to the same school anymore. It was hard.
It just feels helpful when I have people around me who can talk about it, who are going through the same thing as me. And when with some activities or schoolwork or something, to not make it as hard or challenging or stressful, because it's much different than things used to be.
When I need to talk, I just need somebody to listen.
Someone to kind of connect to, I guess, to talk to better. Definitely a new friend or something like that, just to share opinions with and just have a good, positive conversation with.
Just being in school has really supported me over the past couple weeks, and just being able to have that connection with the teacher and not look at the screen as much as I was doing when school was all online.
Well, I think just knowing that the people who I care about, like my friends and stuff, having them knowing that they're there to support me and that they care about me has been helping a lot. So just keep your head held high. Things get harder before they get better. You just gotta keep your head held high, keep your hopes up, and don't let this ruin it. If you can keep your head held high, I promise things will get better. They have for me.
Have a positive attitude and keep moving forward. Like, real talk, man. Always remember, like, the storm always ends.
So thanks again for those brilliant students. Whoops, sorry. Thanks again for those brilliant students and their words of wisdom. In the chat, there was a bit.ly, so a link in the chat, which sends you directly to handouts of this slide deck. And on that slide deck, on the handouts are hyperlinks. So anything that we reference that is hyperlinked, the handouts have active hyperlinks for you to use later. So speaking of students and hearing their voices, the Edmonds School District has expanded its services with Panorama to create and implement a student wellness survey for grades 3 through 12. This survey measured how students perceive their own social and emotional skills, and it is administered in the fall, winter, and spring. This is the first year we have done the student wellness survey, and so we have no pre-pandemic data to compare results to. It is important to keep in mind that a global pandemic may negatively impact students, and reported scores have a wide range of contributing factors. This is data that we have collected during the winter 2021 Panorama survey. About 64% of the students were surveyed responded, which is slightly over 10,000 of our students, 3rd through 12th grades. The reported scores are broken down into 5 rating categories. You can see them here: almost never, once in a while, sometimes, frequently, and almost always. While green typically indicates a positive rating, it is important to keep in mind that answering sometimes during a pandemic may be considered a normal response during such an abnormal time. As you can see, when we asked grades 3 through 6 how often they are feeling sad, about 25% of them said sometimes, but 65% said once in a while or almost never. When asked about feeling worried, we see similar results, with 25% reporting sometimes and 62% reporting once in a while or almost never. In this age group, sadness and worry can sometimes present as anger. So when we asked how often they were feeling mad, we see similar results, with 28% reporting sometimes and 58% reporting once in a while or almost never. The last question we asked students was how often they felt lonely. Here, we also see very similar results in that 21% report sometimes and 63% report once in a while or almost never. This next slide is a snapshot of the same data as the previous slide, but for grades 7 through 12. When we asked this group of students how often they're feeling sad, about 30% of them said once in a while, and 31% of them said sometimes. When we asked about worried, we see similar results, with 26% reporting once in a while and 31% reporting sometimes. Students reported feeling angry once in a while, 31% of the time, and sometimes 34% of the time. The results for how lonely these students reported feeling show 28% sometimes and 47% reporting once in a while or almost never. If you were to ask your child how they were feeling this past week, how do you think they would respond? As part of the survey, students were asked about how they feel about their supportive relationships at school. When asked how connected students in grades 3 through 6 felt to adults in their school right now, 33% reported quite connected and 34% reported somewhat connected. When considering how connected they felt to other students, they reported 31% as quite connected and 28% somewhat connected. Overall, elementary students report higher levels of connection when compared to secondary students. This may be due to their willingness to have their cameras on during remote learning and having only one teacher and class to connect to. This slide shows the responses for students in grades 7 through 12 who were asked about supportive relationships at school. When asked how connected these students felt to their school right now, 35% reported somewhat connected, 31% reported slightly connected, and 16% reported not connected at all. When considering how connected they felt to other students, 27% reported somewhat connected, 31% reported slightly connected, and 29% reported not connected at all. Please keep in mind that many secondary students are not turning on their screens during remote learning, which can directly contribute to a lack of feeling connected, and they have up to 6 different classes and teachers to navigate. We hope with our return to in-person learning next year, students will report an increase in feeling connected overall. This data was very helpful and was very paramount in driving our ongoing staff professional development and focused on the areas of connecting and engagement for all of our students this year. Once again, you will find a bit.ly link to the Access handouts in the chat.
All right, sorry about that. So I am Mr. Hearn, and I'm the interim principal at Westgate Elementary. And I have the honor of presenting how the Edmonds School District supports the mental health needs of our students. Okay, so in the Edmonds School District, We actively promote a culture of caring by caring for ourselves, caring for each other, and caring for this place. Here are some support staff in schools that care for our families and students. You can click on the title to access the hyperlink to find out how to connect your child's school support staff. So I'm going to go through each one of them. School counselors care by providing immediate crisis intervention and referrals for ongoing care, teaching strategies for self-care, developing safety plans, communicating with families, and collaborating with teachers for classroom support. School psychologists care by partnering with families, teachers, school administrators, and other professionals to create a safe, healthy, and supportive learning environment through their expertise in educational evaluations, mental health, learning, behavior, and educational systems. Student support advocates support the complex needs of our students and families in secondary schools, focus on access to mental health, housing stability, navigating community resources, and early identification of drug and alcohol use with follow-up treatment referrals as needed. Family resource advocates care by providing support to students, families through crisis, whether it's mental health, medical, housing, and they help support families in navigating resources both within and outside the school system. School nurses care by bridging healthcare and education through the promotion of health and wellness. Students, families, and the community can receive assistance with access and referrals to healthcare providers, prevention and control of communicable diseases, chronic disease management, emergency care, mental health support, and more. Okay, so what does student support look like in the classroom? The classroom teachers are intentionally building culture and climate through community, through evidence-based practices like responsive classroom. Classroom teachers promote the social emotional development, safety, and well-being of our students through second step lessons that are research-based, teacher-informed, and classroom tested. School counselors deliver age-appropriate guidance lessons on anti-bullying, suicide prevention, which is called Stress Happens, personal safety, and problem-solving skills. School-wide, we have annual suicide prevention and CPS reporting training. School staff, some of them that I've already mentioned, are available to assist students and families with social, emotional, well-being needs. Then we have universal school-wide intervention systems in place to assess, track, and monitor student mental health needs. Programs called PBIS, Panorama, SWIS, MTSS, Check and Connects. Social emotional learning focus in each school improvement plan. So what does it look like in the district? We have board policies. We have strategic, district strategic plans. We have community partnerships that you're gonna hear a little later in this presentation. We have harassment, intimidation, bullying, and safe schools reporting, suicide prevention, intervention, and postvention policies and practices. We have social emotional panorama screener, grades 3 through 12, that happens 4 times a year.
Okay, so my name is Cassie Barney. I am one of the school psychologists at Linwood High School, and I'm just going to be sharing some common things we might have seen in our students this year, and also some signs of what we should be looking for maybe taking the next step and getting them more support. Next slide. Right, so we want a big takeaway for you to be that this past year was hard, and some changes in behaviors and feelings in our students are really in the realm of normal. They're normal reactions to an absolutely abnormal time. So I hope that you walk away from this with hope recovery is the norm. In all disasters throughout time, it's actually the norm for the vast majority of people to recover. And so just remember that. And many of the things that you may have seen in your child this year, while definitely difficult and worrisome, are really in the realm of normal and will probably kind of go back to normal as we start returning to our routines and in-person school and being able to see friends, all those wonderful things that we're starting to be able to enjoy again. So some of those normal things that you might have seen over the past year could be symptoms of anxiety or depression, because it was just within the nature of the pandemic. We had to withdraw into our rooms and not spend time with friends, which are symptoms of depression. It was natural to feel a lot more worry about what was going to happen next or stress about school. You might have noticed that your child was more angry than usual, or had a lot of grief and sadness at the things that they lost. We lost a lot of things like friend time, field days, sports, rites of passage, not to mention more heavy, sad things like losing family members. A big one that we probably all saw, and we definitely are seeing in the school setting, is the struggle to stay motivated, feeling burnt out about school, and feeling tired all the time. This is also related to those difficulties with focusing, organization, and memory. So just know if your student really struggled with school this year, they are definitely not alone, and it will continue to be a priority within our school district to support those students moving forward in their education. It was a really typical response, and also encouragingly, as we've started to be able to see some students come back in the building, it's almost an immediate re-engagement and increase in motivation. And finally, feeling sensitive, easily irritated, overly emotional. It's like those typical child, preteen, teenage mood swings, but magnified by a lot. Again, those were typical responses because it was a really hard year and we didn't have our many of our typical coping strategies and outlets that we would have for the stressors of day-to-day life. That being said, there's definitely some warning signs that it might be time to seek extra support, whether that's reaching out to one of the many people that are available at school or just going straight to seeking a therapist for your student. So some of these signs include, and this would be like if you were seeing these for at least 2 weeks, so constant feelings of anxiety or depression. So maybe they've tried some strategies as if maybe there's been changes of circumstances, but the symptoms are not alleviating or getting better. If you're noticing your child is really struggling to get through basic daily tasks, if they can't sleep or they're sleeping all the time, if their eating habits have changed a lot, whether they're not eating or they're eating way more than they used to, or if they've just really stopped showering or caring for themselves, that's a big warning sign. If they've really withdrawn and it's a noticeable behavior change, or of course, if they're using unhealthy ways of dealing with all of this. So self-harm for sure, or alcohol and drug use would be some other examples. These are some wonderful resources and infographics that cover what we just talked about and also summarize some additional risk factors when we're thinking about if a student is at risk for suicide. And so some of those risk factors can include, a diagnosis of mental illness, a connection with someone that has died by suicide, just experiencing a huge change in life circumstances, whether that's, a big move, a graduation, a breakup, or I'm not sure if I mentioned this, a connection with someone, whether it's a friend or a family member that has died by suicide. And also warning signs that you want to be looking for. So if you hear these things and you're being done or said by your child, I encourage you to immediately seek help and support, and we will provide you those resources going forward, is listening for things like statements, I don't want to live anymore, giving away prized possessions, heavy substance use, things of that nature. And I really encourage you to check out these resources and have them available to refer to. There's also really great ones for youth. We can show the next slide as well. This is a flyer that was created this year, and it is been posted in all of our secondary schools. It is, very prevalent and present for our students in their buildings, and it kind of goes over all the things that I just shared with you, not only the normal reactions for abnormal times, but also some great strategies for how youth can proactively care for themselves and keep themselves mentally and physically well. There's such a connection there. And then some hotline numbers for them to seek support, and those same warning signs and risk factors that I shared about when they want to seek extra support. And, as caregivers, hearing or seeing these signs can feel really scary, and you may feel nervous about how to respond best. So that's just a great segue into our next presenter, because we are going to give you some concrete tools about how to talk to your child about their mental health.
So I'm Kirsten Vargs. I'm a school psychologist at Linwood High School. So you may be wondering, how do I have a conversation about mental health with my student? You can go ahead, next slide. So the first thing you want to think about is setting the scene. So you want to find a good place and a good time to have a conversation. So pick a time where you and your student are relaxed. It's probably not a good idea to have this conversation if you're rushing somewhere or someone's sick or hungry. So you want to find a good time. And in terms of place, just find a place where you and your student will be most comfortable. So for some of us, that might be, a Starbucks or a cafe or a park, or maybe it's when you're doing the dishes or going for a walk with your student. A lot of times having a conversation while you're also doing something can kind of take the pressure off. I know I personally at school will have a lot of conversations walking outside with students because we are not directly looking at one another. And it can be easier to talk about things that are uncomfortable. The next thing you want to keep in mind is you want to be genuine. So for most everybody, it's really uncomfortable to talk about mental health. So it's okay to say that. It's okay to say, this is hard. I'm nervous. I might mess this up, but I'm going to try my best because I care about you and I want us to have this conversation. You also want to use words that your student understands. So using words that are age appropriate, while also avoiding slang, and also resisting the urge to use vague language. So a lot of times I will hear people use the words, I feel bad, or use language that's not very clear. So it's okay to use phrases like depression, anxiety, suicide, or for smaller children, I'm having big feelings. It's okay to use those words and explain what they are. Next slide, please. So listening. Your goal is to talk as little as possible so that your student can talk as much as possible. And you want to approach what they say with curiosity. So I know this is really hard sometimes as a parent, but just doing your best to listen non-judgmentally. A lot of times it's more important to allow your student to talk rather than what you say to them. And with that in mind, silence is okay. A lot of us especially when we're talking about something new or uncomfortable. We need a little more time to chew it over or to think about it or to answer with care. So many of us are used to filling space with words, and it will feel weird, but just do your best to let silence be there. Also, and this is really hard, but you're opening a door in which you may hear things that are really hard to hear as, you know, a caregiver for your student. So try your best not to freak out. Your students' feelings are valid, even if you don't understand them or even if you can't relate to them. It can be really hard, but just resist the initial impulse to problem solve. So often as adults, we want to fix things for our children or the children in our care because we care about them. But we also at the same time want to be able to give our students the ability to problem solve themselves. So doing your best to listen and accept whatever your student shares. One great tip that you will often see therapists use is paraphrasing back what a person says to them. So just using the same words and repeating it back to someone really helps that person feel heard and validated. Next slide, please. Okay, so on that problem solving vein, resist that urge to jump in and fix it. You really want to allow your student to share their ideas first. Ask them, what do you think would help? Have you thought of anything? And then asking permission to help them problem solve or brainstorm if they need that. You also want to be super clear in saying, I want to support you. What does that look like? Oftentimes students have really good ideas of what they would like us to do, and they're just waiting for us to ask. And the last thing, this is really hard. It's super, super hard to talk about mental health with your student. So just accept that you're not going to get it perfect right away. And this is not a one and done conversation. This is many conversations you're going to have over a long period of time. And just because you get maybe a less than amazing response from your student, that doesn't mean that you should give up. You just want to keep trying and keep trying and keep trying. You're doing a great job, and every conversation you have just shows that to your student that you really care about them. We have on this slide, actually, I know this is a lot, that's like 10 tips, which is hard to remember, especially when you're trying to have a conversation. So at the bottom of the slide is a link to all these tips in both English and Spanish as a flyer. Next slide, please. And this is an amazing resource that Joanna shared with me. This is twist on truth or dare. It's truth or challenge. And these are all questions. The actual graphic, if you click on the links below, is much bigger, and they're great conversation starters that you can have with your student most any time around the dinner table, or when you're driving, or just when you feel like connecting.
Hi, I'm Kelly Christensen, and I am the Student Support Advocate at Linwood High School. And I'm going to talk to you all a little bit about some of our community partners that we are so fortunate to have in Edmonds School District, because truly in Edmonds School District, we care so much about the whole child as we support their learning. I think next we've got a video to show about one of our partners.
Hi, Edmonds School District. My name is Daniel Schwartz, and I'm the Director of Relations here at CareSolace. CareSolace is a mental health company that's on a mission to break down the barriers for accessing mental health support. We have a database of over 130,000 providers across the United States of all different pathways of care. including individual therapy, psychiatric services, higher levels of care like intensive outpatient, partial hospitalization, residential and inpatient psychiatric. We have resources that accept all different types of insurance, including private, Medicaid, and sliding scale and free resources. We're available to all students, family members, staff, and staff family members to use as a tool 24/7. What's really cool about our service is we have a tool that's available to school staff where they can refer a student and then track that student's progress in getting connected to a provider. So if you're in need of mental health resources, I strongly encourage you to reach out to your school counselor or your school psychologist and ask them about CareSolace. Here, your school counselor will be able to do what we call a warm handoff, and they'll be able to follow your progress. They're not going to be able to see our communications to or from you, but they are going to know when you've booked an appointment and whether or not you've gone to that appointment. This really allows for support from the school district to be able to follow up with you, see how that appointment went for you, and make sure that you're taken care of. So again, ask your school counselor about doing a warm handoff if you're in need of any mental health or substance use support. In addition to this, we also have a 24/7 self-service link where you can search on your own to find a mental health provider. In addition to this, you can translate this page into any language. And under book appointment is our 24/7 contact. If you want a care coordinator to help you call resources and book an appointment, we're available by email, phone, and video chat 24/7 in any language. So I really hope that you use our resource. We're available 24/7. Edmonds.
So CareSolace is a newer partner for us, but they've already proven themselves to be really indispensable in so many ways. And one of the real benefits is that warm handoff between school staff and you and your child, so that we know exactly kind of if you've been able to connect to a therapist that they have in their referral source. So we really are loving this relationship with CareSolace. Next slide. So Edmonds School District, we have had partners. We've got two primary partners that we've had for so many years. And I will tell you, it started with one therapist part-time, and we have grown to, gosh, probably like 10 to 15, maybe even more therapists in our buildings. And so that really, we've expanded these programs, and one of them is therapeutic health services, because we really see that when we can reduce the barriers for students in accessing mental health care, they're far more likely to follow through with getting the help that they need. So THS is a really wonderful partner for us. And to connect to them, you can certainly contact your child's school, and we'll be able to connect. And this particular one, the ICTP program, is secondary only at this point. But next slide. And then CHS has been our longest partner, Center for Human Services, and that is, they serve in elementary, middle, and high schools. Another great way you can connect to them is just connecting to your school. So contact the counseling department, contact the school psychologist at your school, or of course your student support advocate. And I would also add that really when we are we're providing this wraparound support for students and their families, is that when they are seeing an outside provider and they're connecting to their school, we are able to really help them, like your student, follow whatever their treatment plan is in the school setting. So it's really beneficial, it's really effective when we are able to have that collaboration. You'll see on this page, which I know is going to be, it's in each of these links, you can get more information about this particular resource. But this is just for you to kind of go through when you have some time to see. There are so many resources out there for mental health. And if you would like help kind of figuring out, okay, which one is best for my student, which one's best for my family, again, connect to your school, and we will be happy to kind of walk you through that and help you along this process. And all of this you will have in the handouts.
Awesome. Thank you so much, Kelly. Hi, everyone. My name is Sally Guzman. My pronouns are she, her, and I'm here to talk to you about a few more resources, but also as I am talking at you, please feel free on the bottom of your screen to use the question and answers button. This will let you type in a question. Feel free to type that in English or in Spanish. Yo se lo puedo responder. That way you all can use the time after I'm done to ask our amazing panelists some questions. So on this slide here, we have a great resource for you, again, hyperlinked in the link shared for you, with some tips on how to keep summer safe and healthy, which means making sure we're taking care of our whole selves, and that includes our minds. Some strategies to think about, again, are what we've talked about throughout this training, staying connected, keeping those conversations going. Next slide, please. So as a district, we think mental health is critical and important, our students' social emotional well-being, and we do this throughout the year in a variety of ways and providing opportunities for learning for our families, the first of which is we are recording tonight's session for you all, and this will be shared on our district's YouTube page, our district website, and our Facebook page. Additionally, as a community, we also take social emotional learning very important. So our parent council, Edmonds Parent Leaders Council has put together an event on June 3rd, which is free via Zoom. The links to register are included in the slide here. And they're bringing in a speaker to talk about being positive during a pandemic. And again, how we can use some simple strategies to maintain our social emotional well-being. And they are working to have interpretation available at that session as well. On June 10th, our district is partnering with, as Kelly mentioned, Center for Human Services, who is our mental health therapist who provide in-school mental health counseling to students during the day. They will be doing a learning session open to staff, families, community, and students, learning on how to support our students through some difficult times. It will not be a webinar setting and will be a more open classroom setting and, you know, availability to do small groups and that kind of thing. So we hope that you save that date, and we will be putting a more formal flyer in Peach Jar for you. Next slide, please. So again, we just talked a lot, but we want to make sure that you know that your schools are here to support you holistically as a whole person. And so, you know, as we mentioned today, you have school counselors that are in your kindergarten through 12th grade schools. You have your school psychologists, you have your nurses, you have your advocates, both in elementary and secondary, that are available to you during the school year, during regular hours. Our district also has a family support phone line that runs in the summer throughout the weekdays. If you call 425-431-1454, one of our advocates will pick up and help you navigate whatever it is you're needing this summer, whether it's finding out where our nearest grab-and-go meal site is, or if you are having a concern about your student and need someone to talk you through what the next steps are. So I think that's it for that slide. Next slide, please. Last but not least, our wonderful support, Amanda Ralston, is going to help put in the chat a link to a feedback survey. In this survey, we just want to know how you enjoyed our webinar tonight, but we'll also give you an opportunity to let us know if you need to connect with someone, and our amazing team here will reach out to you and make sure that you get that support that you need. So thank you all so much for coming. I don't see anything in the question and answers, but I hope that if you are curious and still have a question, that you feel free to put that in the chat. Sorry, in the questions and answers, not the chat.
Thank you, everybody, for coming in regards to being here tonight and for starting this conversation with all of us. We will be here for a little while longer in case anybody has any questions that they would like to ask. But otherwise, feel free to use that Google form link to let us know, and we can follow up with you more individually. Because this is, an important topic to talk about. But, many thanks to, again, the Suicide Prevention Committee and for all the people who helped support bringing this incredible webinar to life and doing so in such a quick manner. But we really wanted to make sure that we were addressing this very important topic during this very challenging year. So we can all just be in this together and move forward together. So any questions, feel free to ask and we'll hang out for a little bit. If I could ask all of the panel members to just turn on your videos real quick so they can see the faces behind all this incredible work. I would just love to highlight you guys very, very briefly. And I know that some of you might not be camera ready, but I would love for you to turn on your videos and get the acknowledgement for all the hard work that you've all done. So thank you so much. Okay. Well, I think we'll wrap this up then. Thank you so much for everybody attending, and thank you everybody for all the hard work again. Oh, I do see one. Oh, thank you. Thank you so much. I appreciate somebody thanked us in the question and answer. So that was very kind of you. I appreciate that. So continue the good work. Hang in there as we move forward together, and we look forward to continuing this conversation with all of you. Have a good evening.